Hello students, in this session I will be talking about anti-human globulin test, which is otherwise called as Coombs test. We have seen about Coombs test positive or negative under the acquired extracorpuscular defect of hemolytic anemia classification. So here we will see the Coombs test as a special test for hemolytic anemia. So what is Coombs test? Coombs test is otherwise called as anti-human globulin test. It was discovered by Coombs et al. In 1945. The antiglobulin test can be used to detect the red cells sensitized with IgG alloantibodies or IgG autoantibodies or complement components. I have told in my previous class what is alloantibodies and what is autoantibodies. Sensitization of red cells can occur in vivo, that is within the body, or in vitro, outside the body. The use of anti-human serum, globulin serum, to detect these sensitization of red cells in vitro is a two-stage technique known as indirect globulin test, and the sensitized red cells in vivo is detects by one stage technique. The technique is called as direct antiglobulin test. Coming on to the principle of the test, as already told, it detects the incomplete antibodies or complement binding antibodies either in vitro or in vivo. So the principle says that the incomplete antibodies, usually IgG is an incomplete type of antibody attached to the red cell membrane by the FAB portion of the immunoglobulin molecule. The IgG molecule attached to the red cells are unable to bridge the gap between the sensitized red cells, which are separated from each other by the negative charge on their surface, and the sensitized red cells do not agglutinate. See, here you can see the RBCs, and these are the sensitized cells. If the RBC is attached with the antibody, blue color antibody is the attached, here only attachment is taken. But those attachments cannot combine. That is called as sensitized RBC. So when anti-human globulin is added to the serum, added to the washed red cells or the sensitized cells, the FAB portion of the anti-human globulin molecule reacts with the FC portion of the IgG molecule or incomplete molecule, which is already attached to the red cell, thereby bridging the gap. They bridge the two antibodies and get the red cells together, sensitized red cells together. When they get them together, an agglutination is seen. This is anti-human globulin. So in the slide you can see how the red cell is coated with the antibody, that is what we call it as sensitized red cell, and green color antibody you see is the Coombs sera, which bridges or gets together the sensitized red blood cells. What is Coombs sera? Serum from an rabbit or other animals previously immunized with purified human globulins to prepare antibodies directed against IgG and complement are used in the direct or indirect Coombs test. This is also called as anti-human globulin reagent. Coming on to the direct test, as already told, there are two types of tests: direct antiglobulin test or direct Coombs test, and indirect antiglobulin test or indirect Coombs test. So direct antiglobulin test, as the name suggests, it is direct because the patient will already be having sensitized RBCs. Sensitized RBCs are RBCs to which antibody are attached but no visible agglutination is seen. These are sensitized RBCs. To this, when antiglobulin reagent is added, they bridge the gap and agglutination is seen. Right? So 2 drops of patient's 5% cell suspension is prepared. To that, 1 drop of anti-human globulin reagent is added, mix and wait for 5 minutes and then look for agglutination. If agglutination is there, direct Coombs test is positive. If agglutination is absent, direct Coombs test is negative. This is indirect Coombs test. Indirect, as the name suggests, here we cannot get the result directly by adding anti-human globulin. We have to prepare the serum what we use. We have to add red cells so that sensitized RBCs are prepared. So the patient's serum is tested here, that is testing for incomplete antibodies. So patient's serum is taken, to that cells are added. Here we call them as a screening cells, that is O positive red cells. O positive red cells are used because they have the Rh antigen. O positive red cells are taken, 1 drop serum and 1 drop, 2 drops of 5% O positive red cell suspension is taken, mixed and incubate at 37 degrees centigrade for 45 minutes, 30 minutes to 45 minutes. So during this incubation, what happens? The RBCs get attached to the antibodies, that is sensitization occurs. So after 45 minutes, look for agglutination. If no agglutination, centrifuge in the centrifuge at 1500 rpm for 2 minutes. Discard the supernatant. Now washing is done. As I have told earlier also, in blood bank we do the washing procedure, that is to this button of cells or sediment of cells what you get, to that you add normal saline, mix the content properly and you do the centrifugation again. By doing this, what happens is any unbound antibodies on the RBCs are present, that will be removed off. So you centrifuge, you get again their supernatant and sediment RBCs. We want only the sediment RBCs. The supernatant is discarded. Again you add saline, mix the content and centrifuge, discard the supernatant. By washing leathers, you get only the sediment. After discarding that sediment, to that sediment you are going to add anti-human globulin. Mix the content properly. If required, you can go for centrifugation, or else if you keep it for 5 to 10 minutes, you will get agglutination if the serum contains incomplete antibodies. This is indirect Coombs test. Since direct procedure is not there, it is called indirect. Indications of the test. For direct Coombs test, as already told in my previous diagnostic test procedures and all, it is autoimmune hemolytic anemia, blood transfusion reaction, drug induced red cell sensitization. Indications for indirect Coombs test are compatibility testing, screening and identification of unexpected antibodies in the serum. The factors which affect this anti-human globulin test are, the first one is the temperature. Optimum temperature for Coombs test, that is especially indirect Coombs test, is 37 degrees centigrade. Incubation at lower temperature can reduce the sensitivity, while the higher temperature will damage the red cells. That is factor affecting temperature. Second factor affecting is serum cell ratio. So increasing the ratio of serum to the red cells increases the sensitivity. Commonly used ratio is 2 drops of serum and 1 drop of 5% cell suspension. The third factor is the incubation time. For saline, since we use the saline medium here, the saline medium, the incubation time is 45 to 60 minutes. So these were the things to be told about the Coombs test. With the Coombs test, this is the final slide. I hereby finish the entire hemolytic anemia. So under hemolytic anemia, we have seen what is hemolytic anemia, classification of hemolytic anemia. We have seen under different classified hemolytic anemias, we have seen their laboratory diagnosis. and also we have seen the special tests related to hemolytic anemia.